I am Dr. Naveen Tiagu, orthopedic surgeon. This is video 5 of the tendon series. In this series, we are discussing about tendon issues and how these tendon issues are a little bit different from other bone, joints, muscles, and how the management differs. I'll tell you one scenario. Take, for example, you did everything right, and then the pain settled. You went back to the activity, and then all the pain came back. If that has happened to you more than once, this video is definitely for you. This is for general education, and if you have persistent pain, please consult a qualified healthcare professional. In the last video, we covered what actually works when it comes to tendon. It is always progressive loading and building the capacity of the tendon over time. But knowing what works is only half the picture. The other half is understanding what keeps getting in the way. Let me take you through 6 patterns I see most often in the clinic. The first pattern is complete rest. Pain starts and you stop all the activities and then pain reduces. That feels very logical to stop and then pain reduces. But here is what is actually happening. Rest reduces the symptoms. Only the symptoms. It does not restore the capacity of the tendons. The tendon feels better for some time, but it does not become stronger to withstand that load. So when the load returns, the tendon is no more prepared than it was before, and that's why the cycle repeats. The goal is not rest, it is the load management. The tendon pain happens when the load exceeds the capacity. The recovery happens when the capacity is rebuilt. The second pattern is using pain as the only measure of progress. The pain goes down and you feel you are recovering. The pain comes back. It feels like something has gone wrong. But this is the thing about tendons. Pain does not always reflect what is happening in the tissue. A tendon can be structurally changed and completely pain-free, or painful with very little structural change at all. So a difficult day does not mean you are going backwards. A more useful question is this: can you do more now than you put a few months ago? That is capacity. That is the actual measure. Third pattern is returning to the full activity too soon after feeling better. This is the most common reason for recurrence. The pain settles, you feel you are ready back for action, and you go back for sports or your activity that is the usual load, and within days or weeks what happens is the pain returns. Feeling better is not the same as being ready. The tendon takes time, it adapts slowly over weeks or months, not days. There is always a gap between symptoms improving and capacity being restored. That gap is where the recurrence happens every time. So it is a very slow phase and usually takes months. The fourth pattern often surprises people. Stretching the painful tendon is the fourth pattern. It feels very intuitive. The area feels tight. The stretching should help. But here is something important. Certain tendons, especially where they get attached to the bone, are sensitive and not just to tension but also to compression. Both the forces. Stretching these tendons aggressively can apply both forces at the same time. In some cases, this increases the irritation and not reduce the problem. This is why not every tendon problem benefits from stretching. And this is exactly why individual assessments matters when it comes to tendon issues. The fifth pattern is expecting a single treatment to solve the entire problem. Rest helped briefly, injections helped briefly, exercise helped a little, but nothing lasted. Here is why. The passive treatments, as I said, can reduce the pain, but pain reduction is not the same as rebuilding the capacity. These treatments can support the recovery. They can make loading more manageable, but on their own, without a loading plan behind them, the results will not last very long. The treatment is progressive, load, consistent, gradual, and over time. And the sixth pattern, which I commonly see in the clinic, is the one that keeps the cycle going. long after everything has settled. That is inconsistent loading. This is also little common. A good week, then a difficult week, then stopping completely, then starting again from scratch. The tendons do not respond well to the extremes, either be it rest or too much of load. Too much of load is a problem, but too little load is also a problem. Remember, what tendon response is consistent, gradual progression, not perfect, just steady. Now look at all the six of these patterns. If you just summarize, or you want to have a single anchor on how the six patterns have come, the load is either too little or too much of load, or it is poorly managed. One of the threes. That is the entire problem, and that is exactly what the tendon continuity model explains. The tendon moves forward or backward based on how the load is applied, as described in the continuum model. So if you take one thing from this series, the tendon recovery is not about finding a shortcut. It is about giving your tendon what it actually needs. The right load at the right time with enough patience to let it adapt. If your tendon pain has been going in cycle, now you understand why the pattern happens, why the cycle pattern happens, and more importantly, you know what needs to change. If this has helped you, like, share, subscribe. You can also join my WhatsApp channel. I will show the QR code at the end. This video is for educational purpose only. It does not replace medical advice, diagnosis, or treatment. Please consult a qualified healthcare professional for individual case decisions. Goodbye. See you in the next video.